A top medical journal is warning climate change is set to become the defining narrative of human health. It will trigger food shortages, deadly disasters, and disease outbreaks that would rival the toll of the novel coronavirus. Rising temperatures are bringing higher rates of heat illness. More insects are carrying tropical diseases. Plant pollen in the air is worsening asthma and other respiratory illnesses. Residents across states are inhaling smoke from wildfires. Crops are failing and bringing devastating food shortages. All of these and many more are reasons why dozens of health experts have stated aggressive efforts to curb greenhouse gas emissions from human activities that could avert millions of unnecessary deaths. Dr. Salim Srani joins us live to discuss the impacts of climate change on our health. Dr. Srani, thank you so much for being with us this morning yet again. We appreciate you like always. So which countries are the major culprit of increased greenhouse gas?
Good morning, Barbie. Glad to be here. One of the things is, I think we already discussed that the green gas emission is a challenge. The fossil fuels, the wood burning, the deforestation are the major thing. But let me give you an example. The carbon dioxide emission from Australia is 417 million. US is 5.22 billion. China is 9.8. India is roughly around 2.5 billion parts. So if you look at it, the key contenders are China, then US, then European nation, and India. And if you look at China and US, China is going up and up. India is going up and up. Even though the China has done a lot in trying to cut down on the fossil fuel emission, but their population is so high, and same is the case with the India. Whereas US, if you look at from 2000 to now, it's kind of steady. It's not really increasing too much in compared to the other nations. But this is a global challenge, and everyone needs to do a significantly more to decrease the green gas emission.
How can we decrease the greenhouse gas emission?
One of the things is that there are two ways. One is the government and everyone is trying to make an effort to make the safe energy, try to decrease the fossil fuel, try to decrease the deforestation. But what we can do ourselves has a lot to do with that, because we can blame a lot on the industries. Yes, they do have a lot of green gas emission, but we do play a part. A lot of the things we can do in our part. One is we can plant trees, very simple, in your backyard and anywhere we can find. We can try to change our dietary habits, because if you have a meat and dairy product, that requires a lot of land, water, and energy. So we can go from the vegetable source. We can stop using the plastics because it takes a lot to degrade them. We can change into recyclable ones. We can try to insulate our home, shut off the light when we are not using, shut off our computer when we are not using, try to do a carpool, use the public transport. We can use a bicycle to the work or walk to the near distance. And those are all the things which are small in nature, but that can actually help to decrease the increasing level of the temperature and the consequences because of that.
Can an increasing temperatures cause health problems?
Absolutely. First of all, if you have a very high temperature, you can have a heat stroke. If you're working outside, that's a challenge. But increased temperature can cause increased weird type of fungal infections. And also it can cause increase in the communicable disease. The other thing is when you have those increased methane gas and the carbon dioxide in the atmosphere, that can cause a lot of respiratory illness. You have increased allergies, you have asthma, you have irritants in the airway, your breathing is impaired, and that increases your hospitalization and your health.
And climate-related health threats, they affect our children the most, which should be an eye-opener right there. Thank you so much, Dr. Srani, for being with us this morning. As always, we appreciate you. If you have a question for Dr. Srani, all you have to do is text your question to the following number, the number on your screen, 361-855-6397.